I'm at Sunset Dental Care with Dr. Van Dyke. And Doctor, we've been talking about sleep apnea and some of the health-related issues that can result. Let's assume that I come to you and determine I do have a problem.
Right.
Where do I begin? I mean, will it help me if I go right to this, and will it solve my problem sooner, or what should I do?
Well, first you're going to get tested, because we need to know how bad it is. We suspect there's a problem, so you're either going to go, more often than not, you go into the sleep lab, and they test you, and they find out, are you mild, moderate, or severe? Now, in the AASM, that's the American Academy of Sleep Medicine, with the MD world sleep group, they qualify that if you are a severe, which means we talked about the apneic event. Well, one of the ways of scoring that is what's called your apnea-hypopnea index number. If you do that 30 times or more an hour, you quit breathing over the course of a night.
That's severe.
That's considered severe.
Okay.
If you are 5 to 15 is mild, and 15 to 30 is considered moderate. So that's what we'd have to find out first.
Okay.
Once we find that out, then we say, okay, Tim, what are your options? And you know what? Ultimately, the patient has the choice.
Sure.
But what's important is that you understand why you might want to choose one over the other. So if you're severe, we definitely are going to talk about a CPAP. It is the gold standard for treatment of sleep apnea. Really, no matter what level you are, it is. However, if you're mild to moderate, the AASM says, so if you're under 30 events, you do have the choice as the patient, for sure, to choose a CPAP or an oral appliance. So I guess if we look at CPAPs first,
Sure.
we can turn this on, you can kind of hear how loud it is. It's not all that bad, really.
Oh, that's much quieter than I thought it would be.
Yeah, it's like a very quiet fan. It's not all that bad.
Sure.
And there are many forms of different masks. This is just one. This one happens to go over the nose and the mouth.
Sure.
Okay.
All right. Very attractive.
Oh yeah, very attractive.
You're watching Medical Montana.